When I was in medical school, I really couldn't figure out what I really wanted to do. I liked a little bit of everything. And then ultimately, I had to sit down with one of my mentors at that point in time, and he basically looked at me and said, you like a little bit of everything, that's family medicine.
We offer a 3-year residency for physicians that want to go into the field of family medicine. We're the 3rd largest residency program for family medicine throughout the country.
When I found out that this residency program existed, and when I looked into it a little more, I got really excited because it seemed to hit on all of the things that I was looking for in my medical training. It focused on rural medicine, which obviously was a big draw for me. And then in addition to that, they really touted a really strong inpatient program and really intense training that way, which was great because I knew going off into a rural area, I wanted to know as much as I possibly could.
I think one of the advantages of our residency program is that the residents all do a mandatory rotation through our sports medicine program. So they get to interact with our fellows on a regular basis and get active teaching there along with our faculty. We try to emphasize musculoskeletal exam techniques, which is something we don't get much of in our normal residency programs. But that's going to be something that's very useful for them when they get out into private practice.
Of course, athletics here at the University of Alabama are very important, and we serve the athletics department through our fellowship and our sports medicine physicians. We also have a geriatrics program, and as a large percentage of the population grows older, there's really not enough physicians specializing in this particular age group. We also have a wonderful psychiatry fellowship here, so we offer an extra year of training for those family physicians that want to focus on behavioral health. Our hospitalist fellowship attracts physicians from all over the country that want to practice primarily in the hospitalist setting and need that extra year of training after a family medicine residency. Our OB fellowship also provides family physicians with an opportunity to provide surgical OB to their patients in rural communities, as well as our emergency medicine fellowship, which provides family docs that want an extra year of training in the field of emergency medicine.
So the Emergency Medicine Fellowship is one of 9 fellowships around the country in emergency medicine. To qualify for that fellowship, you have to finish 3 years of training in family medicine. It is designed for residents who want to practice full-time family medicine, especially in rural areas.
So looking at residency programs, I was really drawn to the unopposed programs, specifically because you get access to the entire hospital, nowhere's off limits, and especially here we have things like an open ICU, and we rotate through with the OBGYN service and the pediatric service and get to spend a lot of hands-on time with those patients, not on the periphery, not as an add-on to other residents who are pediatric or OBGYN residents, but as the primary caregivers for those patients.
So, you kind of get best of both worlds, which is very, very rare across the country. One that kind of does both an unopposed program, but also university affiliated. And you do feel like you're a part of the university. We, tailgate and do things like that and really enjoy, our time, celebrating the football team. But then also there's lots of different faculty events and things like that we're invited to here in the residency.
Our program is very diverse. People from Alabama, from outside, from other states, from other countries. But what I've seen unique in the last few years, a lot of people tend to stay after they graduate in the area here, as they like the towns, they like Alabama, they like the people. They have a lot of opportunities for practice. For the last year, our graduates, 6 of them went to do family medicine, 1 went to do hospital medicine, 1 decided to go directly into ER medicine, 3 of them went to fellowships, 1 went to the direct patient care. So there is a lot of diversity in our graduates as well. I think it's very helpful to our mission and to our state, Alabama, and to the Southeast in general.